Welcome to the Beat Podcast, Supervisor Joe Simitian. I'm pleased to have you back again today for another wonderful conversation. Can you tell the audience a little bit about yourself?
Well, hi, Nick. Thanks for another opportunity to share some thoughts. I'm County Supervisor Joe Simitian. I think you know I have served in elected office now at 5 different levels over the years. Started out as a member of the Palo Alto School Board and then was a mayor and council member in Palo Alto. Did an earlier stint on the Board of Supervisors, then went off to Sacramento for a dozen years where I served in the state assembly and the state senate. And when I was termed out of the state legislature, I thought, I really found the work at the county tremendously satisfying. I'd like the opportunity to try that again. And came back in 2013 and been back on the board now for a decade. So started life on the East Coast, was raised by a single mom till I was probably 14, then moved to California. I lived with my dad and my stepmother and went off to Palo Alto High School. And the peninsula in the South Bay really was the place I was supposed to be to turn out to be the person I was supposed to be. And I've been here ever since. And so, off to college and law school and graduate school, but this is home. And as I say, I feel very fortunate I ended up in the right place for me and have had an opportunity to do this kind of work now for folks in my area in 5 different venues. So what are we going to talk about today?
Well, it is a joy to have you back.
Thanks.
It's always nice to see you around here at the hospital. And today we are talking about affordable medicines. Mm-hmm. In previous episode, which I encourage everybody to go listen to, in which we talked about affordable healthcare as a whole. Today, we're going a little bit deeper and into the more specific programs, which allow people the opportunity to have access to more affordable medicines, life-saving medications in a lot of these cases, and the programs in which you champion that allow those things to happen.
I'm going to speak about this pretty colloquially, I guess is the best way, in layman's terms. Too many drugs cost too damn much. Let me just put it right out there. And, people are telling me, hey, it's costing me an arm and a leg for things that are absolutely life essential. And I found my way to this topic in a very unusual way, actually. When I was in the state legislature, I had an annual contest called There Ought to Be a Law. And I invited my constituents to suggest legislation every year. And I really didn't know if it would fly. I didn't know if it would work, but I wanted to hear more from the folks I represented. And one year during my state senate time, I had a group of Stanford med students who said, hey, you ought to find a way to recycle medicines that are unused in the system. And I was a little taken aback, and it didn't resonate with me right away. It seemed an odd suggestion, and then I discovered there were other parts of the country where they had made some pretty good progress already. And the notion that these med students had was, if we've got unused medications in clinical facilities around the state or the nation that are just being tossed away, sometimes in the water, which is not a good thing. Sometimes they're incinerated. Why don't we see if we can't make good use of those medications by getting them to people who need them and who have issues around the cost? And because these medications are so carefully tracked and they are in tamper-proof, tamper-resistant, tamper-evident packaging, if you're at a skilled nursing facility and discover that a patient has changed their medication, moved to another facility, may have passed away, but you've got these drugs, rather than toss perfectly good drugs on one side of the street when there's a need on the other side of the street, shouldn't there be a way to find a clearinghouse? And so I carried legislation that the med students had suggested, and it passed. And it was not easy. The state boards and agencies who were responsible for pharmacies are understandably concerned about making sure that drugs don't go off to places they shouldn't or get misused or abused. But ultimately, we were able to pass a law that said county pharmacies around the state could use this program and be the beneficiaries of drugs that are donated to them and get them to people in need. And that has ended up producing what we call our Better Health Pharmacy here in Santa Clara County. And the only requirement is a prescription. You walk in the door, you hand over your prescription, and if it's a drug in stock, it's free. And we're taking steps to expand the program. Some legislation recently that I actually had a follow-up bill that tried to make this whole process a little easier. There's been more recent legislation now. Great group I should give a shout out to called Serum, sort of centered around the Stanford campus. They've become the clearinghouse for not just the whole state, but other parts of the nation as well. And again, it's a really simple notion. If somebody on one side of the street has drugs they don't need, and we can get them somebody on the other side of the street who needs those drugs, let's find a way to do it. And it can be done safely, has been now for more than a decade. And I just think that's the kind of creative thinking that our valley is known for. And, now it's proved itself.
What a truly phenomenal story, too, about people taking ownership over their community and saying, I think this ought to be a law. I think that's really, really cool.
We're a little self-congratulatory here in the valley sometimes, but it is no brag to say we got a lot of bright, caring, and engaged folks. And, I felt strongly then and still do as an elected official, you're missing the boat if you don't listen to people. I had a colleague years ago, a friend of mine who was on the city council in Palo Alto with me, and he used to joke that probably 100% of the folks in town thought they were smarter than he was, and 80% of them were probably right. So a little bit of that humility, I think, is helpful in the process. No matter how capable you are, how educated you are, how experienced you are, there are good ideas out there from other folks. And truly, in the category of things I would never have thought of on my own, recycling, drugs here in California, that wasn't ever going to pop into the thinking. So those Stanford med students now have a legacy that, is really, I think, a wonderful and remarkable one. They thought there ought to be a law. Now there is. And, folks here in the county are the beneficiaries all these years later.
I love that. And you also answered a question that I was going to ask. When you talk about recycled medication, what are the specific ways that you ensure that they're safe and able to be recycled?
Well, recycle is probably not the right word, but I can't come up with a better way of describing it. Every one of these drugs has a tracking record and an identifier, and that process is very rigorous and maintained and is a prerequisite so that folks know where it came from, where it's been, what it is, and the state bureaucracy is actually more focused on making sure these drugs don't fall into the wrong hands, quote unquote. And that was frustrating to me because I thought folks at the state level weren't as focused on helping get affordable, or in this case, free medications to people who desperately needed them. And that was my mission, and it sometimes bumped into the other missions at state level a little bit, but we worked it out. As I say, I had to refine the legislation during my time, and more recently it's been amended again. We're now looking at folks in San Mateo County and San Francisco being authorized to make the same system work in their pharmacies. So I think it is an idea that will inevitably get more and more traction and benefit more and more people. And that's, as I say, that's very heartening for me, but it should be very heartening for a group of Stanford med students who probably haven't followed it all these years later.
Well, that is wonderful. And I know that we have a few other programs to talk about this morning, and that's just one great example.
We should probably talk about MedAssist, which is, as I listened and watched folks at the federal and state levels struggle with the issue of drug pricing, I was clear that there isn't a lot we can do here at the county level to affect drug pricing per se. These are state and national issues. But I finally got to the point where I thought, we just can't wait for a comprehensive solution at the state or federal level. We got to figure something out for folks here at home, particularly for what I call, life essential drugs, things that they're not question of nice to have. They're an absolute got to have it. And, we're talking about folks with diabetes who need insulin or other medications, all of which are quite expensive. Folks who have severe allergies and can end up in anaphylactic shock and who need EpiPens, just to use the brand name, or folks who have asthma, and which is a real struggle for a lot of folks. And those inhalers are not cheap. And again, for some folks, if they've got a really first-rate insurance program, they may be okay. But for a lot of folks who don't, or who have less than high-end insurance policies, this stuff really does cost an arm and a leg. The price increases, and we don't need to get into the debate about whether or not the price increases are justified or not. Again, that's a debate at the state and national level. All I know is it costs too much for, I'm trying to watch my language here, Nick. It costs too much for folks who, absolutely require these drugs to stay alive. And so we created a program here with the help of the staff at VMC and at the county pharmacy called MedAssist. And essentially what it does is it provides a subsidy, a reimbursement program for folks who require one of those three sets of products. If you're diabetic, I want you to be mindful. If you are subject to allergic reaction, I want you to be mindful. If you are someone who's struggling with asthma, I want you to be mindful. There is a program at the county, and it's not just for folks who are, quote, low income. It is a program that is there for folks who make what we used to think of as a pretty good middle class income, but who are nonetheless struggling to make these costs work, given the high cost of the valley and the high cost of the drugs compounding it. So again, we still need action at the state and federal level. My hope is we'll get that one day soon, but I was just of the view we couldn't let it go.
So for MedAssist, which it's been phenomenal to see this program take off, having had the opportunity to create videos showcasing who's eligible, and it's so many people. What was the inception of the program, if you will? Because I know we talked about ought to be a law. What was MedAssist's process?
Well, again, I want to give credit where credit was due. We were having this conversation in my office one day with some of the folks on my staff, and we were talking about Better Health Pharmacy, which we talked about earlier, and then one of my staff people, a guy named Brian, said, what's so galling is that drugs that are absolutely essential to a significant chunk of the population are in this category, and isn't there something we can do about it? And so I said, all right, let's see if we can figure it out. Sat down, tapped the interest that I already had in the subject, and the interest that my folks in my office did. Then reached out to folks here at VMC and in the pharmacy and said, are you game? And they were, and asked my board colleagues to weigh in behalf of the effort, and they got it right away and said absolutely. And here we are. And now we got a program. And, the most important thing to me is that people know the program is there and don't think, oh, I probably don't qualify. I mean, we're talking about income levels that are working professionals who would qualify for the MedAssist program. And, my one push, and Nick, this won't surprise you knowing me as you do, I just kept pressing on our own folks to keep it simple. Didn't need a lot of bells and whistles. Well, we could do this. No, let's keep this simple. There are three groups of folks out there who are paying an arm and a leg. Let's find a way to make sure they can afford what they need so that they're not going without, so that they're not splitting medications, so that they're, keeping themselves healthy. And the team here responded marvelously well. And we did resist the temptation to keep adding or making it more complex. So it's pretty straightforward. You use one of these drugs or products, and you turn in your bills, and you get a good chunk of the cost rebated back to you. And it's not a global solution, long-term, big picture, but until the feds and the folks at the state level can do more, it's going to be a lifesaver, literally, for some folks here in the county.
Well, I really love that you do see the efforts come to life of the collaboration of so many people on the ground, not just looking at numbers, but really probably getting to hear from people who this is directly benefiting. And we've talked about Better Health. We've talked about MedAssist. There's so many details to go into, but Have you talked with anybody who has directly benefited from this, and you've been able to see firsthand what an impact this has had?
Oh, yeah, absolutely. And, the stories are really quite moving. Everybody's busy. We all live our lives. I think there's a natural human tendency to think that the challenges you face are the challenges everybody else faces, and that the comforts you enjoy are the comforts everybody else enjoys. And that's really not the case, of course. So when you can hear firsthand the experience by some other member of the community who's lived a different life than you have, and they're telling you just how tough it was before a program like MedAssist made this better scene possible, it's as I say, it's very moving stuff. And it's one of the reasons why I have become a bit of an evangelist on MedAssist. I want more people to use the program. I know that there are hundreds of thousands of folks out there in Santa Clara County who require these drugs, and certainly tens of thousands, if not more, who would qualify. And we just need to make sure they know that the programs are there, and we need to continue to be sure that it is easy to demonstrate your need and apply for the support, because there is relief, there is help, there is a way to make sure that you get the help you need. But we got to keep telling that story, which is why I'm here with you, so I can keep telling that story.
Absolutely. And talking about showcasing the need for it, I don't know if you mentioned this already. Is there a particular type of insurance that one would need in order to qualify for the MedAssist program? No.
Look, no matter where you get your care is part of the slogan, actually, on all this. We want to be there for you. And it doesn't matter what pharmacy you go to, doesn't matter what kind of insurance policy you get. If you are, if you don't have the need because you've got an insurance policy that covers all this stuff, that's a different story. Because we want to make sure that we're helping folks who really have the need. And if we can help folks get the kind of insurance that would give them better coverage, we're going to do that, of course. It's one of the benefits of having folks connected with our system, is we can sometimes get them to a better place in terms of their insurance coverage. But, this is not a program that small d discriminates with respect to when, where, and how you get your coverage. Otherwise, if you've got the need, we're going to be there. And again, even folks who are relatively successful in their lives and making a pretty good income, when they are confronted with costs of this magnitude, it can really work a hardship.
In a previous episode, when we talked about affordable healthcare and access to that, we talked about the First County Pharmacy in District 5. Is that a pharmacy that people participating in this programs can go there to get these medicines?
Yeah, we've got a pharmacy now in Mountain View that is right next door, literally, to the Planned Parenthood clinic there, and a small suite of offices for our own county health center. It's been gratifying to me because it's a start. It's a step down the right path of bringing these kinds of services into the North County that haven't been there before. So we've got a pharmacy there now that is accessible to folks, and as I say, literally right next door to the Planned Parenthood clinic in Mountain View that serves so many of my constituents. And my hope is that when we have a full-blown clinic, the first of its kind, in my district on that Mountain View Palo Alto border, my hope and expectation is that there'll be a pharmacy there as well, and that these services will be available in a way that's just convenient for folks. Years ago, I had a boss who took me aside and said, look, if you want something from somebody, make it easy for them to give it to you. And it's advice, obviously, that I've taken to heart. I remember it all these years later. And it applies to healthcare. If we want folks to keep themselves healthy, we need to make it easy for them to do that. And we can say, well, they could, they should, they oughta. But the fact of the matter is, if we make medications easily accessible and affordable, we're more likely to see people keep themselves on a good track.
Well, whether it's new facilities, updated facilities, new programs, it is very apparent that you're not slowing down in championing these systems for people. I think that's really amazing to hear. Is there any last remarks that you want to leave people with on this subject?
Well, I'm smiling when you say you're not slowing down because, bluntly, I have 2 years left on the Board of Supervisors before I'm termed out. So the things that I have been pushing on are things I want to see come to fruition before I walk out the door and turn out the lights. And if I can't see them fully realized, and in some cases you won't because the work always goes on, you sort of take the baton from somebody, and when it's time to walk out the door, you pass it to somebody else. But if I can't see some of these initiatives fully realized, I want to make sure that they are well enough along that they're going to not just survive, but thrive after I finish my time on the Board of Supervisors, because it's the work. I'm pretty sure that, 20 years from now, people will say, Joe who? I'm okay with that. But I'm not okay with them saying, didn't there used to be a program called MedAssist? 20 years from now, I want to make sure that some way, somehow, people who need that help are getting that help. And just like, virtually no one who walks in the Better Health Pharmacy today knows that those Stanford Med students deserve a shout out. But I know it, and they do. But most important, is that the programs and services, and in this case, the free medications that people need, are available all these years later.
Wonderful. Well, thank you so much, Supervisor Joe Simitian, for your dedication to public service and really better health for all. And we thank you for taking the time to come on the beat today.
Thanks, Nick.